Hey guys, it's Cindy back from Sanford Pharmacy, helping this week with Rock Creek Spilling the Tea. Today I'm going to be going over protecting your health with Gardasil 9, a powerful tool against HPV-related diseases. So just some background, Gardasil 9 is a human papillomavirus vaccine, also known as HPV, that protects against 9 types of HPV. These 9 types include 5 high-risk types, which are type 16, 18, 31, 33, and 45. And these types are known to cause cervical, vaginal, vulvar, anal, or throat cancer. And then it also helps protect against 4 low-risk HPV types, which are types 6, 11, 52, and 58, that can cause papillomas, which are also just known as warts. What is HPV? HPV is a virus that lives in different cells of the body that are on the surfaces of skin. HPV is also found on moist surfaces and membranes, which include the nostrils, the mouth, the throat, ears, genitals, and the anus. And overall, there are 200 related types of HPV virus. So HPV is currently considered the most commonly transmitted STI. There are more than 42 million Americans considered to be infected with different types of HPV that are known to cause disease, and an estimated 13 million adults and teenagers will become infected each year. So HPV facts versus myths. I just got some questions for y'all. So question 1 is HPV can only be spread through sexual contact. And that one is false. A lot of people don't realize HPV is not spread just sexually. It can be spread through close contact with an open sore if you don't realize somebody has it, or through using the same utensils or passing saliva. So a lot of people can get HPV through kissing and they don't realize that's a common form of it. And so it's just far larger than just sexual contact on how it can be transmitted. Question 2 is HPV is a disease that only impacts females. While I feel like people relate HPV to females more because it is the number one cause of cervical cancer, it's also the number one cause of throat cancer that a lot of people don't realize, and that can impact men or women. And then our third question is the HPV vaccine causes infertility. And that is also false. HPV vaccines have been around for numerous years, and several other countries, such as Australia, are in a goal to reach cervical cancer elimination by 2040. And they've shown that fertility is still fully functioning in women that receive the shot, and it actually helps increase their fertility health because they're not struggling with cervical issues. So why should I get the Gardasil 9 vaccine? For one, HPV transmission. HPV isn't solely transmitted through sexual activity, just like we were saying earlier. It can be spread through saliva or even skin-to-skin contact. So just getting the vaccine helps you prevent yourself from getting HPV transmission. There's also the cancer prevention. It helps reduce risk of HPV-related cancers regardless of sexual activity. And then for people that also develop warts, it can help with that. I know several people that get plantar warts on the bottom of their feet, and the HPV vaccine helped resolve that because it helped their immune system learn how to fight the HPV infection that they had, but also because cervical rates are going down with this thing, and it prevents you from getting anal and throat cancer. There's also herd immunity. The more people that are vaccinated, the less flare-ups of HPV virus that we're going to see. And since it's not a virus like the flu or COVID that you can actively see that somebody has, herd immunity is really important with this vaccine because you might come in contact with somebody that has the virus and you not be aware since they aren't showing physical indicators of it. And then just early protection as well. Preteens and individuals that are not sexually active gain full protection by being vaccinated as early as possible before sexual activity and or transmission. So who should get the shot? This is a big misconception for a lot of people. It is typically recommended for preteens. That's where the push is right now because that's just that age frame before you're kissing people, before you're getting to be in a more intimate setting. And so it's just easier to vaccinate preteens from the ages of 9 to 12. But we also have teenagers and young adults that are still very vulnerable populations that should be vaccinated. If you are not a sexually active individual, we still recommend you getting the vaccine just because you don't know who else has it and when you might come in contact, because again, it is a skin-to-skin infection that can happen, or if you get it from shared objects like glasses or silverware or other things. And then again, men and women both should consider getting this vaccine. For women, it is really important to help reduce the risk of cervical cancer. But for men, it also helps prevent you from getting throat cancer, animal cancer, or any other type of cancer. So, just in conclusion, I think the Gardasil 9 is a very important vaccine. Anybody from the ages of 9 to 45 can receive this vaccine. And if you're having any questions about it, it's always important to consult your doctor or your pharmacist to just discuss the best time to get vaccinated or whether the HPV vaccine is right for you. And it's also helpful to encourage others if you have the HPV vaccine or you know people around you that have not been vaccinated with it, just telling them about it, providing them resources, and telling them to consider looking into it for themselves and then staying informed. I'm a big advocate of people researching things for themselves. And so the CDC is a good place to look, but also several different studies. I know if you just type in Google Australia's cervical cancer motive for 2024, not 2024, sorry, 2040, it'll give you a lot of insight on what Australia is doing and how they're lowering their rates and helping women's health overall. And that is it. Thank you guys.